Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, and the distracting noise in the background is still Health 2021. David, who do we have right now to talk to?
Well, we're very fortunate that we have Andrew Parker. He is the founder and CEO of PAPA.
What is that? Andrew, tell us more.
PAPA connects older adults and families to PALs for companionship, assistance, and transportation. We drive people to the doctor, help them around the house, teach them how to use technology.
Is this like a dating thing, like
Provide
Bumble
support.
and
I think it's just like a company or just like a neighborhood club?
It's a little bit of both. No dating per se, but lonely older people need help, and we send them someone fun to hang out with them.
But that sounds kind of creepy. My 88-year-old mother, why would she call Papa? I mean, that was my grandfather. He's gone. This is confusing.
It's a little confusing. Well, Papa started from my grandpa, Papa. It does come off as a little bit of a dating when you describe it, off the tongue. But she needs someone to drive her, someone to help her, someone to spend time with her, someone to make her food, go to the gym with her, go hang out with her, go to the movies, talk about you, talk crap about you, maybe.
Probably.
Maybe she needs a pal. Maybe
she needs a pal.
Well, have you thought about services for David? I mean, David needs friends. It's not
could
just
be a lost
elder.
cause, though.
Yeah. Well.
Yeah.
So we do family support too. People with children that need care too. Companionship is the term, but it really just means support and assistance and friendship.
So what problem are you trying to solve, and who pays to solve it?
So really, loneliness is the kind of primary topic. Loneliness is like a universal disease. We've all felt it, unless you're a sociopath, which maybe you are. But outside of that, David.
So, there's one in every crowd. Yeah. That's what I'll say.
And we're helping with social determinants. So, food insecurity, loneliness, isolation. If you have issues with those things, your health is going to be negatively impacted. And so we pair you with someone to help with those things and be your friend.
So David didn't frame it correctly, but loneliness is an epidemic, and it's actually growing in every sector of society, in our atomized society where people are living more individually, and particularly, I got to think, during COVID. But, well, before we get to how you handled COVID and created COVID companions, who pays for this?
COVID companions doesn't sound too good.
Yeah. Trademark that one before someone else grabs it.
Yeah, hold on. I have my lawyer in my pocket at all times, ready to go. The health plans are paying for it mostly, so we work with.
Health plans don't want to pay for anything. How did you get them to? I know, because we sell the health plans. That's not an easy road, because they're in the business of taking costs out and reducing costs. So why would they dating, companionship, support, loneliness, how does that become something they'd want to be willing to pay for?
Well, so most of our customers there are Medicare Advantage. They're getting paid from the government to care for someone. And there's things that they have to do to care for people, and also requirements they have, much of which can be done by a non-clinical person, which we call a pal. So I think of them like ninjas. They could go into the home and observe things.
Are they involved in self-defense?
They are. They have swords, and they all have nunchucks. But aside, that's a special
no extra charge. There's a little upcharge on that one.
Nunchucks included. But yeah, I think of them as ninjas because, healthcare ninjas, because we can identify that you're food insecure and you have fall risk, and they don't want to pay for things. But if you end up in the hospital with a claim because of those things, if we could prevent that in a proactive manner, that's fun and engaging, and members are going to sign up for the health plan because of it. They see a huge ROI. And someone said on this event I was at last week in Minneapolis that Papa could almost have an infinite ROI because there's so much nuance, and we only in the healthcare system.
Oh no, you're not just a digital app. They have infinite ROIs. Haven't you seen the $20+ billion going into apps that have software engineers but no purpose or no patience
and no engagement? It requires both software and people, and I think that's the important part. We really use software to remove the software more than anything, to get the person to the home that can be friendly. And it started with my grandpa, who needed help but didn't need bathing, and there's a shortage of bathers or home care professionals and doctors and nurses, and there needed to be a new category, and we created it.
So what are these pals like? What would be like a prototypical pal, and how do you think John would do as a pal?
Terrible. No, I'm just kidding. I think he'd be pretty good, actually.
The thing
he'd
is,
be good for the Irish.
And like you, David, I'm unqualified. So let's start
perfect.
there.
Okay, good.
The perfect pal is me. No, perfect pal originally was college students, nursing students, pre-med students, someone that wanted to get into the field and learn, and they did it. But we really found as someone close to me once called him a professionally nice person, someone that's just honest and trustworthy and got a good personality and, is able to spend time with an older adult and enjoy it. And, it's a mission-driven company, so of course you want to make money, but you also have to want to help people. It's not exactly always easy, and sometimes the situations are hairy. Our average pal right now is about 30 years old. It's empty nesters, stay-at-home moms and dads, younger people. So we have
If
about
you're an empty
20,000
nester at
pals.
30, you raised those children fast, and they flew out of the house.
You may feel so. John actually would be
Middle
good 'cause
school.
I'm an empty nester right now at 33, but that's because I haven't started.
I
it,
thought John would be perfect because he was a dad at 15, so I think you were empty nester by 30 sounds about
Got
right.
started early.
Yeah.
Yeah, so it's just a really nice person. And by removing bathing and toileting, John would do it probably. You'd hang out with the senior.
Yeah.
But I think that the loneliness thing is a big. I mean, it's a huge issue if you look at any metric of behavioral health, and it's true of every demographic, and it's increasingly true, and it's got to have been worse during COVID. But how do the health plans actually measure an ROI for an avoided cost as opposed to a price that was reduced or a network that was narrowed? Like, how do they think about that? And then let's get into kind of how they value it and how you value
One
it.
question at a time. Come on.
Well, I think I just want to prepare him. I'm
Be a
not
pal.
like you and just take shots.
That's okay. I have a good memory. I could handle it all. So really three things. One is we increase membership and retention, which they care about. Two, we reduce costs generally. And three, we help with the metrics that they have to do, like HEDIS measures. We don't do clinical stuff, but we'll sign you up for your annual wellness visit. We'll take you to your doctor. We'll make sure that you know who your assigned primary care physician is. We'll get you your medicine. We'll get you your food. And then we look at the claims data to see if we've reduced costs.
So how do you actually help increase membership?
Well, when today
Are you
yesterday-
signing people up? Well, what?
No, we're not. We're not signing people up for plans. But right now, we're in annual enrollment, which happens between October and December every year, and the health plans are super competitive. And when you're going as a person to decide what you want to sign your mom up for, and they're like, oh, we have Papa, you should sign up because a pal will come spend time with her while you're busy doing podcasts. And
Yeah,
So busy.
it is busy. I know.
and selling
It's busy at
companies.
Health 2021.
At least someone
we
gives-
just am grabbing people off the floor,
At least
one
some-
after another.
At least someone gives us credit for all the hard work that we do, and we appreciate that,
yeah,
Andrew. Now,
yeah.
now there is a distinction between. I mean, the company we're talking about it in the context of healthcare, but you've got Papa, and then kind of Papa Health was added, and also I think with the Papa Docs. Is there a distinction between kind of regular Papa, Papa Health, or does it all go together?
All right, so my background is in telehealth. So when we wanted to think about expanding, we thought about, can we add Papa Docs or Papa Doctors? We actually ended up not doing that because we realized there are so many telehealth companies out there, and the complexity isn't necessarily the telehealth.
Is that a dumb question on David's part? Because it sounds like he was sort of made up a category.
Well, no,
you don't
he
do.
didn't. No, it's my fault actually, and my team's fault because we haven't removed him from the website. But we looked at it, and what we do is actually we enable telehealth. Not our own telehealth right now, though we may do that again in the future. But whatever the health plan offers, which we enable not only telehealth but remote patient monitoring. We just partnered with Health.io. We enable on-demand transportation. We do our own transportation, but we've also partnered with Uber, which we announced yesterday, Uber Health, which we're excited about. So the PALs become enablers. This is another way we drive value and ROI. No one that's 80 years old is going to be able to on their own engage in remote patient monitoring, but with our Health.io partnership and whatever health plan is offering, we could teach them how to use it.
Are
We
you
could plug
more
it
of a
in.
utility connecting to a range of these
Yes.
options?
Yes.
Or do you kind of have unique partnerships where you
Both.
shamelessly push the
Sha-
product
what-
into
John,
that?
when you say shamelessly, I
It's
think
kind of
you're
like you. I
you're
think of you.
editor-
I think you just kind of push.
Shameless.
Yeah,
I think
with
you're
your
edit-
customers.
I think
Are
you're
you still representing pharma?
I think you're.
Are you a pharma guy?
I think you're editorializing when you say shamelessly. I think he does it. He pushes it in a very
Let
measured
him speak
and
for himself. He
objective
seems
manner.
like a very capable guest.
He does.
I'm decently capable. Mostly we are doing whatever the health plan wants. We do have partners, and that's great. But if there is a health plan that has
And
a
how many
solution-
health plans are you now working with?
So Papa works with 70 health plans. Several million
Wow.
members have access to
That's
the
awesome.
benefit. It's a feel-good company. We have grown quite a bit. We're 4 years old. We have about 20,000 pals on the platform. that support. It's a one-to-many, so one PAL supports many members.
How many? What's the ratio like?
It's about a 1 to 30, 1 to 20, depending on the market. Because a member gets 100 or 200 hours a year, so it's a couple hours a week or a couple hours a month, depending on their needs.
So you basically get a budget for loneliness and help.
Exactly, and we're trying to increase that budget, every year. It's part of our job. So.
Yeah. So,
David's thinking about what kind of PAL, how the PAL would help him.
Is
it
thinking,
errands? Is it, do you want to go to the movies, David?
What's interesting is we do the employer business, and we found a lot of self-support is important. People, are burdened. It's work from home.
So basically, I could hire you to have me help myself?
You need a lot of help. You may need more. That. You may need more than a
I may need a palliative pal.
Palliative pal. That's not a bad idea, actually.
Hey, there we go.
Yeah.
Palliative pal.
No, that's where a lot of, socially,
awkward.
Everyone needs a pal.
I didn't want to use the word awkward with you, David.
No,
but I mean,
it does make me feel uncomfortable. But I want to understand what kind of the nature of like a job path or career path for a PAL. I understand it's sort of like as a gig economy thing, but on the other hand, as you scale and as you're actually promising a service to people over a long period of time, and it's not so transactional, just like an Uber or a Lyft driver. I mean, how do you think about, is a PAL somebody that's going to be with you? The company's been around 4 years. Is it a 5, 10, 20-year kind of a path, or is it you're always swapping out the PAL and it's more the system that carries through the continuity?
So, first of all, we assign you a family of PALs. It's like family on demand. So it's me and 4 others. So if I'm not available, it's one of your 4 others. And if I leave the system, it wouldn't negatively affect you. We want PALs to stay in the system as long as possible.
Sounds like John's family.
Yeah,
I got a lot of PALs. I mean, it's a big Irish Catholic family. There's a lot of PALs in my family. Yeah. But they don't always agree with one another. So I guess they're not.
And they
PALs
don't get
with each
paid,
other.
and they have no choice to be part of it.
No, I think that what's interesting about Papa is that if you look at a lot of healthcare systems with better outcomes with similar demographics in Europe, places like Ireland or Denmark, parts of France where communities are still communities and people take care of each other. And what I think is really the genius of what you've done, Andrew, is you're injecting a little bit of community in a place that needs it. And I think particularly for frail and elderly seniors, but I'm sort of shocked at the loneliness numbers that are kind of going up, and they obviously exploded during COVID. How did you handle supporting that connective emotional tissue, the support in errands that create relationships?
Yeah. So
in the middle of a pandemic,
I was snowboarding. I feel like when I'm a huge snowboarder, and when the pandemic happened, it all felt like it happened in like 30 seconds to me, or at least in my experience.
Did you hit a tree?
I didn't hit a tree, but I was on phone calls while riding. I will tell you that.
Not good.
But then they shut down the mountain.
Don't try this at home.
We like you, Andrew. Do not do that.
No, I just saw the Schumacher documentary. I'm going to avoid trees from now on. But what we found is, of course, we were sending younger people to older people's houses, like the worst business you could possibly have, but they needed help. So we did virtual visits to provide assistance from a distance, which I did try to trademark, but I got denied on that one. But so we would go grocery shopping, we'd get them medicine, we'd call them, and we'd do virtual visits. We taught them how to use video. I mean, my background's in telehealth. I always wanted to do video, but I didn't think anyone would use it. It took a huge world-changing moment for that to also be a behavior change for us, our age group, or your age group, and then as well
David's
seniors.
kind of getting old.
I have my own age group.
Each of us seem to have different age groups here. I'm the young one, just to be clear.
Yeah, you don't sound it, but you are.
Yeah, exactly.
I have an old voice.
No, it's a seasoned, gravelly type voice.
So what's the challenge here? I mean, do you become the Uber of relationships? Is that kind of the goal? I mean, because a couple of years ago, everybody wanted to be Uber. Now everybody wants to be Teladoc. Soon they're going to want to be Health Business Group. It'll come soon, David.
I want to be a Health Business Group.
But I think we're, that was everybody. You go to the digital conferences, everyone would be Uber this. And
I don't
want
to be anything. I just want to help.
Problems.
Yeah, I don't want to be any of these companies. I want to just help people with curated companionship. I think we're a much different marketplace, as you would call it, than these other groups. It's curated. It's usually the same person. It's scheduled. It's recurring. It's not a random driver. These services are super important. Uber, for example, we partner with, which we're really excited about.
Don't insult your partners.
I'm not. I love them, and they're great. And they have use case, and we have use case, and that's why we're working together. It's very collaborative. So I think of us just as a new type of healthcare system. What's interesting is back at NB Live, I used to always dream of a health system in the cloud. Before most of these companies even existed in 2013.
Was this related to snowboarding or the digital cloud?
Well, I almost said snowboarding because it's getting cold outside. But no,
People
the digital cloud, yeah.
people were boarding at, I think, Arapahoe Basin yesterday.
Yeah, the climate change is real. Sometimes, short term, it's positive, I guess, in some ways. But for us, it was like, how can we create a new way to deliver care? And it's kind of been like part of my career, delivering care in innovative ways. I did it in virtual care before, and now I'm doing it in in-person and virtual companionship.
Well, it's super exciting, and you couldn't be dealing with in a world that's really, all of our relationships have been stressed. So thanks for joining us, Andrew.
Yeah, absolutely. We'll see you maybe in Las Vegas, although I don't know if I want to stay too close to you out there. A little too wild and crazy.
Yeah.
Anyway, that's it for another edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, CEO of CareCentrix. Please subscribe, and we will be back from Health 2021. Thank you, Andrew, and thank you for educating us about a new form of healthcare.